Hi everyone, I'll kick us off. Welcome to our webinar, Using Cost and Financing Studies to Build Sustainable Early Childhood Systems. Thanks so much for coming. We're really glad you've joined us. My name is Kathryn Tout. I'm Vice President for Early Childhood Research and Partnerships at Child Trends, and I'll help us guide through today's discussion, which is based on a newly available brief. I'm going to put the brief in the chat so you have the link. And it's called Use of Cost and Financing Studies for Early Childhood Care and Education, Designing a System that Meets Families' Needs, is fair to the workforce, and is fiscally feasible. So a very tall order for that brief, but I'm really excited that you'll be able to hear from the authors today as they talk about the content of that brief. I had the honor of working closely with them as they engaged in a very collaborative process to put this important brief together. So today, in the webinar, we'll dig into the content of the brief, explore how cost and financing studies can support the development of more equitable, sustainable early childhood systems, and how these studies are being used nationally, at the state level, and locally. You can submit questions throughout the webinar using the Q&A feature. And later in the session, one of our panelists, Christopher Doss, will moderate a discussion across the panelists and pose audience questions. So as I said, we're joined by just an amazing group of presenters and discussants here who collaborated on this brief. I'm going to do a really brief overview for each. So Lynn Karoly is a senior economist at Rand and professor of policy analysis at the Rand School of Public Policy. Her research focuses on early childhood care and education systems, child and family well-being, labor markets, and social policy. Her recent work has examined ECCE cost and financing, workforce compensation, quality improvement systems, and birth to five systems building. Next, we have Simon Workman. He is principal and co-founder of Prenatal to Five Fiscal Strategies, where he leads work focused on strengthening and sustaining prenatal to five systems through equitable and comprehensive financing strategies. He's conducted childcare cost studies and fiscal analyses for states and communities across the country and helped develop several widely used early childhood finance tools, including the Provider Cost of Quality Calculator and the 50-state childcare cost model. Theresa Hawley is executive director of CELFE, where she partners with states and communities to design innovative policies and funding structures for early childhood education and care systems. She previously served as First Assistant Deputy Governor for Education and Executive Director for the Governor's Office of Early Childhood Development for Illinois. And then Christopher Doss, Senior Economist at Rand and Professor at the Rand School of Public Policy, will moderate our Q&A discussion later in the webinar. His work focuses on education policy, early childhood systems, and the use of research and evidence to improve educational outcomes. So as you can see, we have a wonderful group of panelists, and I'm excited to turn it over now to Lynn Karoly to start.
Thank you, Kathryn. It's great to be here, and welcome everyone. You can turn to the next chart. So as you could tell from the title of our brief, our goal is to think about building sustainable early childhood systems. And we do that by starting with a view of early childhood care and education, ECCE, the abbreviation we'll use throughout the presentation, and the key stakeholders. And we use this schematic as a very simple view of that system. To start, we have families on the left who have infants and toddlers and preschoolers who are in need of care. On the right, we have the ECCE providers. In our case, we're thinking about this as the regulated part of the system, centers and homes, public and private. In the center of this schematic is federal, state, and local governments who help set policies and administer the public part of the system. They are also a source of funding and also reimbursement mechanisms. Together, these three stakeholder groups work together to produce early care and education delivery, and that can be characterized by the number of children enrolled, the quality of the experiences that they have, the cost of that care, and the funding profile. Go ahead to the next chart. Ultimately, as we think about this system, much of what we've been doing in recent years in many ways is piecemeal in terms of reforms to this system, trying to improve different aspects. But what our goal is to view this as a system as a whole and think about systematic changes that would bring us to a more sustainable system. Go ahead to the next chart. So in thinking about this system, we have three objectives for each of those components. On the left, for families, the goal is to provide families and their young children access to high quality care and early learning environments that are safe, promote the development of the children, and meet parents' needs for care, whether that's aspects like location and hours, but most importantly, care that's high quality that families can afford. In the middle, for the providers themselves, our goal is a system that fully reimburses providers for the true cost of high quality ECCE, including competitive compensation for the workforce given their qualifications. And on the right, when we think about families and the public sector together, the goal of this system is to have sufficient funding through parent contributions and public sector subsidies to fully fund the demand for ECCE. On the next chart, I don't think I need to tell this audience that our current system fails to meet these goals in most cases. From the family perspective, families with young children report difficulty finding the care that they need and that they can afford. The care instability has consequences for families in terms of their ability to find and keep employment and affects their employers through their productivity as they work. For providers themselves, the reimbursement for subsidized care often does not cover the true cost of care, and compensation for the workforce is typically not consistent with the expectations given the workforce skills, competencies, and qualifications. And then on the right, the subsidies in the current system that are designed to reduce the cost of care are typically not fully funded to reach even those families who qualify. But many families have income too high to qualify, but so they're not eligible for subsidies, but they still cannot afford the cost of high quality care. Moving to the next chart. So ultimately, our goal in this thinking about this system and the use of cost and financing studies is to answer two key questions. First, what is the total cost of providing care in this system with those objectives that I just talked about? And second, how should we pay for it? Go ahead to the next chart. So we outline in our policy brief a set of analyses that we believe characterize cost and financing studies, and I refer to them as type A through type E. A type A study is a starting point of estimating the per child cost of ECCE. A type B study estimates the demand on the family's part for care for ECCE that's high quality. Type C estimates the total system level cost, not just from the provider perspective, but from the system as a whole. A type D study estimates the total expected sources needed to pay for ECCE, what's available through family contribution, through the existing public sector funds, but also other potential revenue sources that would fill the current funding gap. And then finally, we have type E studies, which identify the potential revenue sources that could fill that funding gap and estimates their economic impact. So we use this as a framework for talking about both studies that have been done in the past, but also going forward. And if you add the build on the next slide, we note that these analyses can be done either separately or they may be conducted together so that you would do, for example, a study that might go from type A all the way through type E. And as we present both the methods and some examples, we'll be showing you examples that capture this diversity of research. Go ahead to the next chart. So this policy brief really aims to inform policymakers, but also those of you who may be producers of this types of studies, but also those who are consumers, and to describe how cost and financing studies are conducted, the objectives at each of the stage associated with the study types I just referred to, the data and methods required, additional assumptions that would be used, and some of the challenges and cautions, but also show how such studies can inform policymaking. The options, for example, for structuring subsidies to support family affordability, the potential sources of revenue to tap to fill any funding gap, and the expected fiscal and economic impacts that might arise from any new taxes or funding sources. Go ahead to the next chart. And I would point out, just as a starting point here, that indeed there has been a proliferation, at least of the type A cost studies that I referred to. So the states shown here in the purple shading, 36 of these states have done at least a type A cost study. And as I go through the presentation today, I'm going to use some examples from work that this group of authors have done. I'll be talking about a study done in Vermont, and then you'll hear from Simon and talking about a study for New York, and Theresa for in Chicago, Illinois. So you're going to hear from a lot of examples that'll help hopefully put the use of these tools and their use into illustrations that'll help inform your thinking. Go ahead to the next chart. So just an overview of where we've been, where we're going. So I've given you an overall description of the framework and the approach, the types of questions that we're trying to answer. I've reviewed the types of studies in the way that we've framed this that fall under cost and financing studies. Now I'm going to quickly illustrate the full approach. I'm not going to delve into a lot of the technical detail, but to give you the big picture. And then we'll turn to some illustrative studies and conclude with cautions for the field. Go ahead to the next chart. So any cost and financing study requires setting out some basic parameters: the jurisdiction where the study will take place, the age groups of the children that will be the focus for the system, the types of providers that are assumed to be in that system, and notably the quality level of the providers in that system, which may be a single high quality profile, or a study may involve comparing different levels of quality across a quality continuum. And then finally, assumptions about the system level infrastructure. And just to illustrate what I mean in these cases, go ahead to the next chart. In the case of the Vermont study that I referenced, so obviously the jurisdiction is Vermont. That study focused on children from birth to kindergarten entry. The providers that we assumed in the system were licensed schools, centers, and homes. We established a high level of quality that was the focus of the study. And we assumed that the state role included, for example, workforce professional development and quality assurance. So we knew what aspects of system infrastructure we needed to cost out. Go ahead to the next chart. So I'm going to talk about the estimates that are developed for the demand side, the family perspective, the supply side on the right, providers, and then the government perspective. So starting with families, on the left, you can see that we need to estimate a number of different parameters or features of the assumed system. So first of all, we need to understand what are the current patterns of care use, for example, the hours and the settings where children are by child age. That typically comes from existing data. But we also want to estimate how care use patterns would change if subsidies were expanded. In other words, if we lowered the cost of care to families by expanding subsidies, we would expect to see some changes in their care use patterns. And then third, we want to understand what parents are currently contributing based on the current system of subsidies, but also what do we want to assume about parents' contributions going forward in the system we're envisioning. Go ahead to the next chart. So from the ECCE provider perspective, we want to estimate the cost per child hour that the provider would face to provide high quality care in their setting where that cost is expected to vary by child age and also the assumed quality features. And we also want to estimate the system level costs. Then go ahead to the next chart. From the perspective of the public sector, we want to understand what is the total public funding that's currently in the system, funds that are already being used that we can hopefully continue to count on, and then to estimate what the future funding gap would be under the system that we're envisioning. And then finally, what revenue sources might be tapped to fill the gap. Go ahead to the next chart. Ultimately, when you put the pieces together, it comes down to a fairly simple equation. First of all, we would have an estimate of the total system cost of care for all the provider types we're assuming, the age groups, based on the demand that families have for hours and care quality. So that's a total cost for the system on an annual basis. We would then subtract from that cost estimate any assumed family contribution, and that would be based on the assumed subsidy structure and the estimated use of care. Now, you could envision a system where families make no contribution. In other words, all ECCE is without charge to families. But most of the time, we're expecting that families would make some contribution, maybe on a sliding scale. So we want to subtract that from the total cost. What remains after we do that is then a number that we can subtract the existing public funding based on the current system. And the resulting bottom line, the box in the bottom with the dashed red outline, that's the estimated funding gap. And it's that funding gap that needs to be filled. So go ahead to the next chart and just to illustrate what these numbers look like in the Vermont study that I referenced. So our estimate for Vermont in 2022 dollars was a total system cost of care of about $645 million. There's a lot of assumptions behind that. Happy to answer questions at the end, but that's the number that we estimated. From that, we assumed families would contribute on a sliding scale, and we had several different schedules. Some where families paid less toward the cost of their care, others where they paid a bit more. And depending upon that contribution schedule from families, their contribution against that $645 million would be $240 to $260 million. And then the existing system in Vermont had about $125 million currently going to ECCE, such as Head Start, the child care subsidies in the system. And so the resulting funding gap in the case of Vermont was arranged depending upon our assumptions about family contribution. The midpoint that we used for most of our estimates was about $260 million. And I would point out that may seem like a large number, especially if you're a Vermonter. Others of you would be in locations where the number would be considerably bigger. But from the perspective of the size of Vermont's economy, that gap was about 0.6% of gross state product, or about just under 3% of the state's current level of appropriations. Go ahead to the next chart. So the last step in undertaking one of these studies, if you go all the way through type E study, would be to estimate how you could fill that funding gap. And that requires two steps. One is to identify potential revenue options, and for each of those options, what each source could contribute. And we can do that looking at single revenue sources or by combining revenue sources. And then second of all, with a macroeconomic model, it's possible to estimate what the economy-wide effects would be of using that particular revenue source at the level required to fill the gap. And those macroeconomic effects might be estimates of how gross state product would change, labor force participation, economic well-being. And again, just to put this in the context of the Vermont study, so I mentioned that $255 million to $279 million gap. $260 million was sort of the baseline reference that we used. We considered three feasible options in the Vermont case. One was a new 1% of payroll tax that would generate, as you can see here, about $196 million. A sales tax, increasing it from the current 6% by one additional percentage point, would generate $85 million. And we also contemplated a new services tax of about 6% that would generate $143 million. So with those estimates, we could look at either could one source or another fill the gap, or would it require a combination? And the bottom line in the end for Vermont was that if we used a modest level of subsidies, one source, the payroll tax, for example, could fill the entire gap. But with a more generous subsidy system, in other words, covering more of the cost of care by the public sector rather than by families, it required using a combination of funding sources. And the macroeconomic effects generally were about what was expected. GDP, gross state product would increase by the amount shown here. There was about an estimated 1% increase in the labor force and relatively small impacts on economic well-being. So with that example and high-level overview, I want to talk about the examples briefly, and then you'll hear from Simon and Theresa more specifically. So on the next slide, as we return to reviewing these illustrative studies, go ahead to the next chart. We reviewed in this policy brief 9 illustrative cost and financing studies. There are many more we could have chosen, but we decided to focus on this group. One was the National Academy study in 2018. The second set of studies were at the state level, and you can see the states represented there, all from the early 2020s. And then at the local level, we had 3 examples that we consider as well. Go ahead to the next chart. One thing to point out across all of these studies performed an analysis A, estimating the provider level cost of ECCE. 8 of them went through level C, analysis C, where they included also the system level cost of care. And then 3 of the studies went as far as analysis D, with estimating the system level funding gap. And then one of the studies, the Vermont study that I use as my illustration, also included analysis through E with the macroeconomic analysis. So you can get a sense that there's a range of different studies that we include in our examples. Go ahead to the next chart. There are some commonalities. All of these studies included sponsors from the public or private sector, government agencies, legislative agencies, and so on. The size of the population varied just because we're talking about different jurisdictions. Most of the studies focused on care from birth to age 5. One study did include school-age care. Most of the studies focused on license settings. And the cost of care estimates were assumed to vary by child age and provider type. In one case or several cases, the variation was also by region. Most studies also estimated the system level costs, and then other assumptions tended to vary. They included assumptions about provider quality, workforce compensation, the demand for care, and family contributions. So let me just illustrate quickly for you the National Academy's example. Many of you will be familiar with this study, which was a follow-on to the Transforming the Workforce study. It focused, even though the workforce study that preceded it went through age 8, this particular follow-on focused on a system from birth to age 5. It did assume features that were consistent with the earlier reports, such as lead teachers in every classroom with a bachelor's degree and other high standards. There was assumed sliding scale subsidy schedule, so families were assumed to make some contribution. But interestingly, that study did not assume that subsidies would be tied to the work status of parents, which allowed for the possibility of higher demand beyond those families that were where all available parents were employed. That study estimated a system level cost of $140 billion in 2016 dollars. That's equivalent to gross domestic product of about less than 1%, 0.75%. The OECD average, by way of comparison, Other high-income countries spend about 0.8% of their GDP. That study did not explore revenue options to fill the gap or the macroeconomic impacts, but it did provide a national benchmark. But much of the action since that study has really focused on states or localities. So I'm pleased to turn the presentation now over to Simon, who will talk about the example of work done in New York by himself and colleagues. Simon.
Thanks so much, Lynn, and hi everyone. Great to have so many of you on the call today. So, yeah, as Lynn said, I'm going to talk, just share a few minutes about some work that we completed in New York a few years ago. So this study was completed on behalf of a group of advocates under the umbrella of Raising New York, which was led by Ed Trust New York. And this was a study that we led at Prenatal to Five Fiscal Strategies, building on some work we had done previously. And with the advocacy group, we were now able to update the study to really get into figuring out what is the cost of their advocacy goals. So they were really looking at what would it cost for universal childcare in New York State. And this was back in 2022, 2021, before the current governor and the mayor of New York City had started talking about universal childcare. So it was a big push of the advocacy community. And we developed so, if you're looking back at the categories that Lynn mentioned, this is really a category A, B, and C. We did not get into the what revenue, a big into analyzing new revenue, but we did do both the cost at the provider level of the cost per child of what the true cost of care is, as well as the system-wide cost to estimate those numbers for the system-wide cost. And, the advocacy group were then able to use it to sort of say, this is what's currently coming into the state in the subsidy system, and this is what our estimate of how much money is needed. So we did develop an Excel-based model, both at that per child level and the statewide cost calculator. And to inform the study, we spent a lot of time talking to providers to make sure we could get information from them on their costs of running their programs, what barriers or challenges they have to meeting state licensing and quality standards, if they had identified any solutions or ways that they could run their program more efficiently, or where they needed additional resources. A lot of time was spent on understanding their staffing patterns and what the supports were needed to meet the needs of children and families. And then we also used a lot of secondary data. So reviewing those standards, looking at default data from the provider cost of quality calculator, the federal tool, which has a lot of data on non-personnel expenses, which, while important, are really a smaller part of the picture compared to salaries and benefits. So often it's okay to rely on a secondary source for those and focus more on salaries, which is what we did in this instance, given that this work was for advocacy purposes rather than specific, policy making or grant making or, actually setting subsidy or contract rates. In order to do the statewide cost estimate, we relied a lot on data from the census, as well as data from the Office of Children and Family Services in New York, their licensing data on where providers were across the state and which type of providers existed. And so from this, we were able to develop these default scenarios to understand the true cost of care in the 5 subsidy regions that they have in New York, as well as a statewide estimate. Okay, next slide. So this now shows you the sample of the results that came out of the model. I'm not going to go into these deeply, but this is basically the type of thing that can come out of there. Thinking about this is a study that fits into that category A, right? So what is the true cost of childcare in New York State? These results that I'm showing you right now are based on using a living wage. They made a selection of what if all of the early childhood workforce in the state was paid a living wage, and we were able to use the MIT living wage calculator to actually create regional living wages based on the 5 subsidy regions they have in the state. And so what you're seeing there is both a statewide average and then the highest cost region and the lowest cost region. So you can see, obviously, in a state like New York, which has New York City and suburbs, which is fairly high cost, as well as the other parts of New York that people don't think about so much, upstate where I live, where costs might be a little lower. But you can see those numbers are significantly higher than the state was currently paying in subsidy, right? So, we have in the report charts that sort of show that, but obviously the state is not paying $30,000 a year for an infant, or even $18,000, $19,000 for a 3-year-old. Certainly they were not back in 2022. We did estimate the costs of meeting the higher quality standards aligned with the state's quality rating improvement system, and the model was able to show us that that was about an 11% increase for centers and about 23% in home-based settings. Because of being smaller settings, there is less children essentially to spread some of those higher costs around. One note, in this modeling, we did use a family childcare model that accounts for a salary or some income for the family childcare provider, so that it was more comparable to center-based. So the family childcare provider in these numbers is built in that they are also making a living wage. And I'll note that these numbers, they are a few years old now. This is from 2022 data. But the lead teacher salary here is about $30.27 an hour for the statewide number. So when you're thinking about what's driving those costs per child, it is a pretty significant increase on the salaries that were being paid at the time. So then those cost per child numbers were used to create 4 different scenarios to understand the bigger question of what is the cost of universal childcare in the state. And you have to make a couple of different assumptions here. Obviously there's lots of assumptions that go into the cost per child, but when you go into looking at these big numbers, the big question is, how many children are you planning to serve? And even a question that seems simple, universal childcare, what does universal mean? It's not 100% of the birth cohort. Kindergarten doesn't even have 100% of 5-year-olds in kindergarten. We know from cities and states that have been implementing universal pre-K for many years that 80% is about the high watermark of where you get to. There's always families that opt out or it doesn't meet their needs. So that's a big assumption that has to be made. So in scenario 1, where it says all children under 5, what you can see there is there's about 1.1 million children 0 to 5, but we then adjusted that to account for the number of children with all available parents in the workforce, because that was their definition of who actually needed care. We adjusted it further for an uptake estimated of 80% uptake for preschool age kids and 60% for infants and toddlers, to account for what we thought was a more realistic accounting of how many children would actually take up the system. But what you see there is if you use the current salaries, you're looking at about $14.7 billion per year for the universal childcare. If you use the living wage salaries, so those cost per child numbers I showed you on the prior slide, you're looking at over $20 billion a year. And obviously those are big numbers. New York is a big state, but those are big numbers even in New York. And so we did create these additional scenarios where we looked at, okay, instead of scenario 1, where it was all children under 5, but with that 80%, 60%, scenario 2 is the one where if you apply all available parents in the workforce. Scenario 3 was if you just looked at an income cut. So if you actually said what's the current subsidy eligibility, which is 85% of state median income. And then finally, as a sort of potential first step, we looked at what would it cost if you moved all the children currently being served by subsidy, but paid those providers at the true cost of care with the living wage or with those current salaries. And so what you can see there, we were able to present sort of 4 steps ranging from just under $1 billion all the way up to $20 billion, which could be used as, this is implementation, like phases, this is, where is your choice and your policy focus. It was felt important to have more than just the $20 billion number, right? So that we weren't just sort of having one big number out there. I will also note that this did include an 8% contribution to infrastructure, because we all know that the cost per child is important, but there's also needs to be an infrastructure to support behind this. So on the next slide, just to share briefly on the impact, these results were used by the advocacy community to highlight the gap between both the current investments, but also the investments that were being proposed in front of the General Assembly that year and by the governor that year, to show that, yes, it's great that, you're talking about putting more money in, but let's be honest about what the true amount of money that is needed is there, and we can support both things. We can be very clear that it's great to get more money, but also be clear that doesn't solve all the problems, right? And being clear about the magnitude of the gap. And that data has then also, in the times of, that we've gone through the last few years, the data has been used to support protecting investments in the budget, right? So not just talking about expanding, but in a world where you aren't able to expand, being able to say, this is why you really have to protect the current investments we have, because we need actually even more money. The numbers from this, this was not predicted in 2022, but the numbers for one of the regions aligns with New York City. And so the data from this model was actually used in the conversation around universal childcare that the current mayor of New York, when he was running for office, those numbers were used. So again, sometimes you don't know what the numbers are going to be used for when you do a study, and you don't see a line item, but they can get picked up by current or future policymakers. And so, I really want to just leave you with that idea that there is a power in having these hard numbers. The advocacy community have been talking about the need to expand, the desire for universal childcare, but no one had a full understanding of the number of how much it would actually cost. And therefore, even though that's not something you're going to get in one legislative session or overnight, you can then make plans, you can hold accountable any proposed investments to be able to be honest about, this is what you're asking it to do, and this is how much money is actually available, so that you can actually develop policy that is data informed with the cost numbers. So that's an example of a big state. Now I'll turn it over to Theresa to talk about a big city.
All right. Well, we have a little bit of a different scene here in Chicago when we were asked, when I was at Illinois Action for Children, by the mayor's office to do a study for them to understand the cost of expanding to universal preschool for 4-year-olds in the city of Chicago. And so this was going to require a pretty big shift in the system that existed in Chicago at the time, which was basically that schools were serving a lot of 3- and 4-year-old kids, mostly in part-day classrooms, low-income children, just a system that was only serving low-income families and those who had special needs. The community-based organizations were serving 3s and 4-year-olds largely in full workday year-round settings. And that we were needing to take that system and shift it to one where all of the 4-year-olds would have access to at least a full school year program that largely would be, much of it would be in schools, much of the expansion would be in schools, especially for those families that were not low income. The community-based organizations, we wanted to make sure that they stayed whole and that they were still able to thrive and exist. Wanted to shift more of the 3-year-olds to being served by those community-based organizations, whether or not they needed a full workday and year-round services. So building more 3-year-old services in those community-based organizations, more infants and toddlers. So getting people to switch their business model to serving more infants and toddlers as the 4-year-old services expanded in the public schools and families chose that for their kids. And most crucially here, making sure there was a spot for every 4-year-old whose parent wanted to enroll them. So because this whole project here was focused on the implementation of a big idea that was going to happen, it was about figuring out how much this would cost, but it was also figuring out like, how are we going to do this? How is this going to be built out over time? So on the next slide, how we went about this is we want to make sure that we were implementing universal pre-K without diminishing the access to services for low-income kids under the age of 4, because we knew that that had happened in other communities as they opened up access to universal pre-K for 4-year-olds. We focused this whole analysis on the cost of care per classroom because we knew that's the unit at which we were going to add services to this system. We weren't going to be adding kid by kid. We were going to be adding classroom by classroom in particular neighborhoods where families would be able to access those services. So the number of kids the number of classrooms that we needed was going to be determined at that neighborhood level, looking at how many classrooms there were, how many children there were in that neighborhood, how many of them we thought needed full workday year round and were going to be better served in that community-based setting versus how many their parents would just choose to have them served in the public school with that school day. So a lot of the estimating that study, the part B of the study, trying to understand who needs what, was a big focus of this study. And then again, when we did the estimating of the cost, we were estimating at the classroom level because we were going to add whole classrooms to this system. And we did those costs separately for the settings that those programs might be in. So schools, small community-based organizations, large community-based organizations, because we were seeing that there were pretty big cost differences there. And importantly, what we were finding from this study was going to inform pretty directly how the city was planning to contract with these organizations and how much money they were going to be giving them for the services that they were going to be delivering. We also included all the estimating for infants, toddlers, 2s, and 3s in our cost model because we wanted to make sure, again, that we were holding those programs harmless and making them be able to thrive. Then the next slide here. The way that we went about this was a pretty participatory process. Folks knew that we were doing a study that was going to directly inform how much their contracts were going to be in the future. So it wasn't that hard to get them to come to a meeting to talk about what does that staffing pattern need to look like, what does the salaries need to look like in that study. And also to say the price of admission to the meeting to be at the table was to give you your detailed budget. So we had a lot of good data here that often you don't have when you're doing a study like this. But again, because it was at that very brass tacks implementation focused level of doing this work, we had a lot of really good data to build upon. We were able to build out then by consensus what was the salary schedule we were using in this cost model, what was the staffing pattern we were using, use people's data to help us estimate those non-personnel costs. And importantly, we assumed that about 60% of the 4-year-olds in the community-based organization would also get childcare subsidy if they were low-income families. So we were able to include that in our estimate. On the school-based side, we were able to use pretty much actual costs from the Chicago Public Schools. And there we had two different ways of estimating it. One, if we were just adding a preschool classroom and not taking into account all the other costs of the school building and in neighborhood schools. And second, if we were opening whole early childhood centers where we had to account for the principal, the security, the facilities. So lots of different things we are taking into account. And on the next slide, I can show you at a high level these results that we got. Again, this is 2018. These are pretty old estimates. You'd need to raise them by at least 30, maybe 50% to see what the costs are today. But we had these different costs in a large mixed age center, a small center, one that didn't serve any infants and toddlers at all, because it really did change how much the cost of preschool looked like in those different kind of settings. Then we took a weighted average of that to understand across the whole city what was the average cost of providing these services in a community-based organization, and then compared that to the public schools. I think it's interesting to see that in our analysis, the public schools were not actually more expensive, but really that was an artifact of the fact that we were looking at the cost of adding classrooms to existing school buildings. That was a lot cheaper. Once you said that the programs were going to be in a community, brand new pre-K center, it was about the same cost, whether it was community-based organization full day year round or school day, school year in a school building. Our big number at the end was $175 million. There were a lot of strategies that were put in place by the city of Chicago to close that gap, including a pretty big expansion that was happening at the same time in state pre-K across the whole state that helped the city a lot with that expansion and towards all of that. So the upshot of this on the next slide, what was the impact of doing this study? Chicago did successfully roll out the expansion of universal preschool to all communities over about 5 5 years, including across the time of the pandemic. So a shout out to Chicago for making it happen in the face of a lot of really challenging situations. All of our estimates of what the gap was and all that became pretty wonky over time because there were other things that changed about the system as we were going. So the Head Start Super Grant that the city of Chicago had was recompeted. A lot of the resources from Head Start got shifted into Early Head Start, which was a great thing, but it changed the makeup of the funding. This study also laid the groundwork for a state level system cost of care completed in 2019. It has led to lots of work that is ongoing in the state of Illinois about the financing of early care and education that we've been working on over time. So lots of impacts from the work at the Chicago level, but the context is everything in how you design and implement these studies. I'll pass it back to you, Lynn.
Right. Thank you, both Theresa and Simon. I just have one more slide. So while I'm finishing this off, you all can be thinking about questions. I see we've had some questions in the Q&A and in fact A's to go along with the Q's. So we're caught up in many respects for the questions you all have had along the way. So go ahead to the next chart. So we're going to finish off by just talking about some of the considerations when designing and executing these types of studies, and this is covered in the conclusion of the brief. First of all, I just want to note you've heard about a range of different studies, and the degree of analytic complexity really was designed to match the study's purpose. So it's not necessarily to do one of the most advanced complex studies that you've heard about here, but think about how the study will be used and what the purpose is and design accordingly. Second of all, you've heard a lot about engaging the constituents, the stakeholders in the process. That's key, and these studies provide great examples of that. You could see some of the key aspects, the assumptions that are required that need thought, and that includes the concept of high quality or a quality continuum, what family contribution would look like, measuring the existing public sector funds, which is no small feat in many cases because that's usually not compiled in a systematic way. And there may be a need to think about the transition from the status quo to whatever that new future looks like. So with that, we can put up the next chart. You can see again, this is the look of the brief plus the link. And now we're going to turn to any remaining questions and answers. Again, some of your questions have been answered. I hope most of them by this point, but I'm going to turn it over to Chris, who's going to help us keep on track with the remaining questions.
Sure. So one question is, how can the field advance the methods? You guys talked about some really complicated and detailed analyses, but every analysis has its shortcomings. So where do you see the field kind of advancing the methods of this type of work?
Thanks, Chris. I'll just start off with some things that may seem kind of technical, but ultimately all of these studies have been limited in one way or another, usually because we don't have all the data we want, especially how families currently use care, the types of care that they use, the different settings, and also something that's required for these studies as you try to understand what the future would look like and how families might change their use of care when the price to them changes as subsidies expand. We need better estimates of how families' care use will change. So that's just an example of where some of the technical aspects and data could be improved. I also think, and our study pointed out, that there's the benefit from guidance documents to help people use these methods with best practices as we continue to advance them. I don't know, Simon, do you want to add anything to my starter list?
Yeah, I think just building, I agree with all of that. I mean, I think, partly it's getting the word out there about these studies, right? That there are studies in a lot of states, as we showed on the map early on. There's a lot of information out there. I think then the key becomes, what do you do with that information, right? I mean, there's partly the idea of, like, as Lynn said, there is a range of different types of studies. And so don't feel overwhelmed at the idea of, like, if you can't do a big study, right? There are tools out there to get some basic level of information. And the New York example I shared, didn't go super deep into a lot of areas because it didn't need to, because it was talking about, getting to a big number. And then the other thing is just being clear on how we talk about those big numbers, right? We need to like be honest about this is how much it costs to do this, and using the costs and financing studies to show we aren't just making up this number. It's really built on, real hard data of like, this is what it actually takes to do this, and not shy away from actually being honest about that. Let's also not be Pollyanna-ish and assume that like someone's going to wave a magic wand and we're going to have that tomorrow. But we can also be really honest about what we have, what we need, right? And then be part of building the solution to get there. Theresa, do you have anything else to add?
There, okay. And I could not get myself to come off of mute. Yeah, so I think that we as a cost modeling community have really tried to work together to advance the field on this. So we have a cost modeling technical network that meets quarterly and has been doing so for about 4 years. As when we send everything out for this webinar, we'll give you some information if you would like to join that and be part of the work that we're doing there. I think that's critical because there is so much methodological advance that we need here. A lot of the thinking about things like the cost of facilities or the cost of benefits within an estimation of this. There's a lot of technical work that still needs to be done, a lot of data and analysis techniques that probably could be improved to make these studies stronger and stronger over time. The other thing I want to point out is that one of the things that you do in these studies, especially if you're looking at trying to figure out the delta, is to map out how much money is being spent in the system now. We do a lot of that at CELFE. Our short change project just does it at the big macro state level, but we also then try to follow that down to the community level, because just because there is this much money happening in the system right now doesn't mean it's spread evenly or equitably across the whole state or the community in which you're in. So there's a lot of work still to be done on the overall understanding of the financing of early care and education systems and how the mechanisms that we put in place translate into how the money flows in the field in the end. So a huge body of research to be continued to be developed over time.
Fantastic. So we have some questions on the states and cities that we talked about that expanded access. One is, how did they prioritize districts or areas for expansion in their rollouts? How was the feedback collected to show effectiveness? And do you know if any of them have changed or expanded their data collection process in the wake of these types of studies?
Great question. Simon or Theresa, I don't know if you want to.
Well, I can say for Chicago, they intentionally said we're going to roll out to our lowest income communities first and make sure that they're fully served before they expanded to serve to other communities across the city, which I think is a great strategy, doing it by place, and that has proven to be good. As well as at that same time, they invested in the Chicago Early Childhood integrated data system, which is housed at CELFE, to make sure that they had good supply and demand data in an integrated way for the city. And that's an investment that a lot of states and cities overlook as they're trying to build out access to early care and education.
Yeah, and the New York example didn't really get into this, but I think in other studies that we've done, we certainly see there is the question of how do you refine even more, especially once you sort of say, okay, the big number's too much. What do we take on as a first cut? In New York, the advocates looked at, okay, what if you move the current, workforce to being paid more that are currently in the subsidy system? We've worked in places where they've even got down to like a zip code analysis and really looking at, where is the highest level of poverty? Where is there sort of low-hanging fruit where people are in care but they're paying for it, and you could switch to payer, right? And that has an immediate impact versus needing to increase supply, right? Where is their family friend and neighbor care? Where is their family child licensing? So much of it comes down to the data. Do you have good data on where the kids are, where the need is, so that you can tie up those two things?
Maybe we have time for one more question. One of the questions asks whether and how this research took into account the challenges of matching families to different sources of funding. So we all know that there's a lot of blending and braiding in the early childhood care, which means that families may or may not know what they are eligible for, and now you're expanding slots. So has the research tried to solve that matching problem as you expand these slots so that ideally everyone who's eligible for it can actually take it up?
I'll just start by saying, I mean, some of that gets down to real nitty-gritty on implementation. And, one way to envision a system is one that doesn't have these different funding streams that segregate people by different, eligibility criteria, and then trying to figure out, okay, can my kid get a slot in Head Start or, some other setting where they're going to use a subsidy. So I know in the National Academy study, that was something that was talked about is you really like a way maybe that states could pool all these sources of money at the state level. But from the perspective of families and children, it just looks like support for my childcare needs, right? And I don't have to think about where it's coming from or what funding stream. So I think that's an area where a lot of work is needed. I see Theresa, Simon also shaking your heads. And often is beyond what these studies are designed to do, but it's a great question. And Simon or Theresa, I don't know if you want to add anything.
Okay, great. Well, we have a couple of questions that we're not able to get to. So what we will do is send out the answers to those questions as we send out the recording with a link to the report, so that hopefully we can keep this conversation going. So just want to take a second to thank everybody for joining us and taking an hour out of your day. Hopefully you found this insightful and thought-provoking. And Lynn, Theresa, Simon, Kathryn, did you want to say any last words?
Nope, thank you all for being here. And thank you, Kathryn, for helping organize us from the beginning.
Yes. Thank you all so much for the helpful information, and thanks everyone for joining us. Have a great rest of your day.
Thanks, everyone.